People are much more attuned, I think, to the problems of social isolation, problems of disconnection, problems of lack of integration. I think the evidence for the sort of toxic health effects of those things is now massive. And I think a lot of people are really around the world are saying, okay, we've got that message, what are we going to do about it? And I think our goal in putting this book together was to provide very clear basis for coming up with solutions and then to spell those solutions out. The New Psychology of Health is designed for a very broad readership. At one level it's a kind of an academic book targeted at researchers but also practitioners in a range of fields, but I think it's something we've designed it as a book that should be kind of accessible and valuable for a very broad readership. We have data from pretty much every clinical population, whether you're talking about new mothers who are having their first child, often suffer from a perceived loss of connection to other people, which is then implicated in things like postnatal depression. You see it in new students, for example, turning up at university, that often they kind of struggle to fit in. But at the other end of the spectrum, we've done a lot of work with retirees, people who are retiring, and what you find is that they kind of miss the sociality of work and the value that they get from the groups they were in there. So that's a really critical group to work with to recreate that sense of connection. And that's also true when people transition into care homes, for example, which we need to be both understanding what's going on there and fairly forensically coming in to meet their needs and to fill the gap that's created by that life change. We know that social disconnection is a problem, but the message is, oh well, it's not just about going out and getting socially connected. There's two key themes for us. One is that when one joins a group, those groups have to be meaningful to you. Your critical point two is that interaction has to be structured by group membership. So ultimately what we're talking about is the curative power of us, so us the group. And actually it's the lack of that sense of usness that's implicated in a lot of the health problems that we identify and discuss, from addiction, depression, trauma and so on. I think there are a lot of people in a range of spheres looking for answers to the questions that we address. You know, social isolation is one of the, if you like, main curses of contemporary society. I think people have woken up to that, and there's a massive market, I think, for evidence-based solutions. A market that really I don't think has been properly addressed, properly tapped. And this book, I think, does that. I think compellingly, but I also think in a way that actually invites people to get on board and be part of the kind of revolution which it envisages and which we actually need in this space.